Jeremy Hunt, the Health Secretary, has vowed to root out doctors who cost patients lives by failing to send them for vital hospital tests soon enough. The GPs will face a system whereby they would be ranked either green for quick referrals if a patient's shown signs of cancer, or red if they miss too many cancer cases. He told the Mail on Sunday, cancer diagnosis levels around the country vary significantly and we must do much more to improve both the level of diagnosis and to bring those GP practices with poor referral rates up to the standards of the best. Good idea? Good proposal?
So yeah, I think actually it's that last bit that for me is really important, which is that actually there are variations across the country, and Mr. Hunt's right to raise that. And what's important is to identify why those variations exist and to support those practices that perhaps aren't referring as many patients to understand how they could do better. So I think at its heart, absolutely. I think naming and shaming, from my own perspective, isn't the best way of supporting GPs to do better. And I think we also need to understand much better why it is that diagnoses are being delayed, because we know there are many, many factors that contribute to it. And sure, possibly not being diagnosed early enough by a GP is one of them. But we talk on the show a lot about the fact that patients don't always recognise the symptoms early enough as well, and why that's so important. So there's lots of kind of elements to this. So I wouldn't personally think that naming and shaming is the right
Isn't there a worry that if you name and shame a practice, then rather than being named and shamed, what they're going to do is over-refer? So you're going to get hospitals full of appointments being taken up by people that are just checking, just to make sure they don't end up on this list.
I think that's exactly right. So for me, when I've been thinking about this, I think there are two key risks. So one of them is exactly that. So as a GP, if I was worried that I was going to be named and shamed, then potentially I'm just going to start referring any patient with a symptom that might possibly be cancer up to the hospital. That could delay people who do have cancer from being seen, because of course the clinics are going to be inundated by patients who are actually healthy. The other risk is that actually a lot of people would be unnecessarily investigated. And we don't talk about this a lot, but we know at the moment, for example, that GPs referring patients urgently up to the hospital, only about 1 in 10 of those patients will turn out to have cancer. So 9 out of 10 people are having investigations they don't need. Now, if it's just a blood test, I guess that's not the end of the world. But actually some of these investigations are in themselves or potentially quite harmful. Colonoscopies, X-rays, that sort of thing.
It's bringing us into line with other European countries. Yeah. And Britain lags behind these countries when it comes to cancer survival rates. The main reason is late diagnosis. If Britain's cancer survival record matched the European average, at least 5,000 fewer people would die of the disease in the UK each year. That's the Department of Health Improving Outcomes source in 2010. So surely it's right that we should get to grips with this, get to grips with it quickly and severely, because 5,000 people have died unnecessarily.
Yeah, of course, Philip, you're right. I mean, we've got to focus on this, and we've got to improve people being diagnosed earlier and therefore potentially being cured of cancer. There's no question about that. I think what we're talking about really here is the methodology is the best way of doing that. So is it through naming and shaming GPs, or is it actually through a number of other ways? So supporting GPs and educating them more effectively, and I know Ali's doing a lot of that in her charity. But also, I think, recognising that a lot of the ways in which we diagnose cancer at the moment are quite blunt tools. So we're not particularly accurate in our diagnosis. The symptoms that we talk about on this show a lot often don't accurately pinpoint people with cancer. So there's a lot of work to be done at the moment in helping us to predict who is more likely to have cancer and make sure that we actually make that diagnosis much more accurate. So I think there's a lot to do. You're absolutely right.
Well, Ali, let's come to you, because you started your charity in 2010 following your diagnosis with pancreatic cancer. The diagnosis came much later because initially it was missed, wasn't it, by the GP?
Well, yes, I went to the GP on a number of occasions, and I was told that the symptoms that I was presenting with could possibly be irritable bowel syndrome, so I was told to go to the chemist and take an over-the-counter remedy, and also indigestion as well, so I was again told to go and take an over-the-counter remedy. I had escalating pain and I knew something wasn't right, and I was one of those people who didn't go to the GP very regularly for myself. For my children, yes, but not for myself. So I was one of those rare attenders that was suddenly in the GP surgery once a week. And yes, my symptoms were missed, and I think it's probably down to the fact of my age as well, because being 41 at my diagnosis, I was quite young to have pancreatic cancer. But ultimately, the pain was escalating, and I took myself off to A&E.
Well, the thing, A&E sent you back, didn't they, eventually?
Yes.
So this is continually wrong by the GP, and you're in increasing pain. And the fact that you are sitting here today is almost certainly down to the reason that you then hopped onto your husband's private health care and you fast-tracked yourself.
Absolutely.
And if you hadn't done that, then this misdiagnosis would possibly have killed you.